The sciatic nerve, or ischial nerve, is the longest and most voluminous nerve in the human body, which carries out both motor functions, that is muscle control, and sensitive functions, that is it deals with the skin sensitivity of the parts it innervates. The sciatic nerve originates in the lumbosacral section of the spine, extends to the buttock, descends along the entire lower limb, dividing into two main branches at knee height, up to the foot. However, when the sciatic nerve becomes inflamed, for example following compression of it or one of its nerve roots, it is called sciatica. This is a very common condition in adults, in particular in people aged 40 to 50 years and over, with an incidence ranging from 5% to 10% in the general population. Sciatica is considered as a set of symptoms rather than a diagnosis of a specific disease. But which are the most common ones? Let's go see them. Lower back pain. Patients with sciatica usually experience pain in the lower back. That is that section of the spinal column located near the lower back. We talk about lumbago, or more simply back pain, but if the pain radiates to the lower limbs, we talk about lumbosciatica. The latter occurs as a result of compression of the sciatic nerve as it becomes inflamed and causes severe pain that manifests itself with different characteristics. It can be of the burning type, meaning that it causes a burning sensation, similar to that caused by fire, or crampiform, meaning that it is a sharp, intense, and penetrating pain that has characteristics similar to those of a cramp. In some cases, however, lumbosciatica manifests itself with numbness, tingling, and small electric shocks in the affected area, which are particularly annoying and painful. Generally, the pain tends to appear in only one half of the body, so much so that it is called unilateral sciatica, but it can also extend to both sides, and in this case it is called bilateral sciatica. Weakening of the lower limbs. Leg pain is one of the typical manifestations of sciatica, where the position assumed by the patient can influence the compression of the sciatic nerve, and therefore the intensity of the pain. Generally, it tends to increase when sitting or standing for long periods of time, or after more or less intense physical efforts, such as walking and climbing stairs, or even following coughing or sneezing. The lower limbs may also be affected by muscle weakness, numbness, and tingling, where there is a sensation of having needles and pins stuck in the leg. Compression of the sciatic nerve can cause a decrease in the muscular strength of the affected limb and an alteration of osteo-tendon reflexes. These are those reflexes in which the response movement, which consists of a rapid involuntary contraction of a muscle, is obtained following a light stimulus applied to a tendon or bone. In case of sciatica, there is a decrease or even absence of these reflexes, in particular the Achilles reflex. It is caused by percussion of the Achilles tendon, with a consequent rapid flexion of the foot due to contraction of the gastrocnemius muscles. Pseudo-sciatica. There is a particular medical condition called pseudo-sciatica or truncated sciatica, where symptoms similar to those of sciatica occur. In this case, the cause can be attributed to what is called Piriformis syndrome, a painful condition of entrapment or compression of the sciatic nerve, where the latter is irritated by the piriformis muscle, a small triangular-shaped muscle located deep in the buttock, behind the gluteus maximus, whose main function is to externally rotate the hip. Piriformis syndrome can be difficult to diagnose as it is easily confused with a herniated disc, sciatica, or lumbosciatica. The main symptoms include reduced movement of the hip joint, pain when palpating the piriformis muscle, numbness, weakness, and tingling along the back of the leg and in the foot, as well as spasms and pain in the buttock. Complications. Although most people recover from sciatica, if it is left neglected for a long time or not treated with the right medical care, some complications can arise. This is because the constant nervous compression of the sciatic nerve can irreversibly damage the nerve and its function, thus risking the symptoms described above becoming permanent. Among the complications of a severely compromised sciatic nerve, we find a total lack of sensation along the affected lower limb and lameness, also known as claudication. It is a walking disorder due to an anatomical or functional alteration of the two lower limbs, in which one of the two limbs moves asymmetrically during walking, thus giving it an uncoordinated and unstable movement. Severe compromise of the sciatic nerve can lead to loss of control of the anal and bladder sphincters. They are very important circular muscles, which, thanks to their contraction or relaxation, allow the emptying of the contents inside the bladder and rectal ampulla. A loss of control of these sphincters causes urinary and fecal incontinence, with a consequent involuntary loss of urine in the first case and of feces and intestinal gas in the second case. Treatment of sciatica, as well as recovery times, depend on both the underlying cause and the degree of inflammation of the sciatic nerve. It is therefore recommended to always contact a specialist in order to alleviate the pain and avoid the onset of some complications, more or less serious. In another video, which you will find as soon as it is available by clicking above, we will see better which are the most effective remedies for reducing inflammation of the sciatic nerve.